If you have a toothache right now, there's one thing you might be doing instinctively that is silently making your pain much worse. And as a dentist, I see this mistake even destroy teeth that could have otherwise been saved. So before you take another sip of mouthwash, another painkiller, or try another home remedy, you need to hear this. Toothache isn't just pain, it's a warning signal. It can mean tooth decay reaching the nerve, pressure building up inside the tooth, inflammation around the tooth, or an infection starting to spread. That's why I'm going to show you 4 very common things I see people do every day that actually make tooth pain worse and not better. The number 1 thing you should never do when you have a toothache is apply heat. A lot of people think heat helps because it sounds logical, right? Heat relaxes muscles. Heat helps with sore joints. But teeth, they're different. Most toothaches are caused by inflammation or infection, and heat does not help with that. In fact, it does the opposite. Heat increases blood flow, and that means more pressure inside the tooth, more swelling, more pain, and if there's infection, it can spread faster. I've seen patients come in after using heat, and their pain went from annoying to unbearable within hours. So remember this rule: cold reduces inflammation, heat feeds it. Another instinctive mistake is chewing on the painful tooth to test it, to see if it's healed already. But every bite creates pressure inside an already inflamed area. If the nerve is irritated, you're basically punching it over and over again. And this can crack a weakened tooth, push the problem deeper, or turn a small issue into a root canal. So don't chew on the painful side. You're only making it worse. Number 3. Painkillers. Now it's important to understand this. Painkillers don't fix toothache. They only mask it. I regularly see people stacking ibuprofen, paracetamol, sometimes even alcohol on top. And that's dangerous. It's bad for your liver, bad for your stomach, and it delays real treatment. So here's the rule with painkillers. If you need painkillers just to function, that's your sign the tooth needs professional care. That's not something to wait on. Now this one is critical. If your toothache comes with swelling, gum bleeding, a bad taste, or pain when biting, that's not something to just wait out. Tooth infections don't magically disappear. They either calm down temporarily or they spread. And if swelling reaches certain spaces in the face or neck, it becomes a real medical emergency. At that point, it's no longer just about your teeth. So take it seriously. And if you want to know the guaranteed fastest ways to calm tooth pain safely at home, and which natural remedies actually work and which ones don't, watch this video next. And I'll see you there.